just your bedroom.
Hello and good evening. It's 6:36 in Germany, so it's nighttime. My husband just went to the store and I didn't feel like going. So I figured, you know what? Why not have a couple and do a little video? Because I know I neglected my videos, and even though only 3 people watch my videos, I was thinking about it today, and I'm like, if anything happens to me, I pass away, this is like an homage to my children and to my husband, who I dearly love. They can go back, watch my videos, and just, feel like I'm still around. I'm in my robe. For a second there, I had a shirt on, like a regular everyday shirt, and I was just like, no. It's 6:37. 1 minute has already passed. I'm not getting into regular clothes. Sorry. Anyway, 14th November of this year, this past, 2 weeks past. Yeah, actually not quite 2 weeks. 9 days. 9 days since that day. World Diabetes Day. Did I celebrate it? Did I acknowledge it? No. 0%. Why not, you ask? Because I'm angry? No. Because I don't care? No, I care very much. It slipped under my radar. I kind of had it in the back of my mind. This day is coming. And then once the day was passed, I'm just like, I should do a video. I should do a video. Because I am one of the million peoples affected by diabetes. I have something called LADA, which in some countries it is considered as type 1.5 diabetes, and in other countries like in Germany, you're just simply type 1. I know there's lots of different classifications. There's type 2 diabetes, which is usually in people with who are overweight, and also people who are elderly. Then there is the typical type 1 diabetes, which usually happens when you're in your early years, say 6 to 8. A very, very, very good friend of mine, actually she's not really a friend of mine anymore, but she had childhood diabetes type 1. So I got a little bit of an inside, look. She told me how she discovered her disease, or her parents discovered her disease. Completely different with me. I did not get diabetes until I was in my 30s. And due to the fact that I am a bigger size woman, yes, I am openly admitting it. I'm not fat shaming myself. It is just realistic. I accept myself. Of course, I should be losing weight and becoming more healthy, obviously, because the heavy weight is not good for my health. For the first, let's say, 6 months to a year, maybe a year and a half, I was diagnosed with type 2 diabetes. I went out, got myself, I don't know if you can tell, can't really tell. This says diabetes type 2, because I was like, I'm not getting a medical bracelet. I'm not going to walk around like, some invalid old lady with an emergency thing. I'm going to have to get my tattoo. I'm going to rock this disease. I'm going to do, things a little bit different. So I got this tattoo because I was diagnosed with this, and you want to believe your doctor. Thank you very much to those, 2-3 doctors that took care of me in those 1.5 years, and especially the one that looks like Ian Malcolm from Jurassic Park. I don't know why he looked like that. He just looked like that. He just looked like that. Yes, my doctor looked like Jeff Goldblum. And anytime he talked to me and he dealt with me, I always kept thinking, oh my God, you look like Jeff Goldblum. This can't be. Maybe I have to insert a picture of Jeff Goldblum now. Jeff Goldblum is a very talented actor, but I'm like, I don't want to be treated by somebody that looks like Jeff Goldblum. And obviously, I am not type 2. I am type 1.5 for Americans and type 1 for people in Europe and in Germany. I was falsely diagnosed by my American doctor. Unfortunately, for 1.5 years, I was led to believe that the reason my numbers weren't doing really great, my numbers kept spiking because I wasn't eating the correct things, I wasn't doing the correct things. And when I guess he did a blood test, they constantly did blood tests, but I guess they never thought about testing what type of diabetes I had, because they automatically assumed big women, they automatically assumed that I had type 2 because I'm a bigger size woman. So instead of, kind of researching this and doing all the checkups, I was basically for a year and a half, I was told I'm not doing enough, I'm not exercising enough, I am not eating the right things. Meanwhile, they sent me to a nutrition expert. That lady told me to eat white bread with ham, and I'm just like, no, this is not very good. I did a semester of nutrition in college, so I know about nutrition. I know about nutrition intake, and I also have done my research on what helps my body and what works for me and what works for me as a diabetic, not just as a person. So after that 1.5 years, I guess he did some kind of test, and he got really quiet and okay, yeah, I can tell, you still need to eat better and stuff, and but I never got this. I'm sorry, I see you're doing your best. Your pancreas is not working. I still got this like, and it was one of those weird moments when your doctor mumbles a little bit, and you're just kind of like, what's going on here? Then he mentioned the word LADA without explaining LADA to me. I'm like, okay, LADA. I have LADA. It's a type of diabetes. I guess LADA. Maybe LADA is a different version of type 2. This man never uttered the words type 1 at all. But he got really quiet and kind of nice after doing these medical tests. But I still didn't really get all the answers. And then I switched to a different doctor, to a German doctor in the local area. And he did a test. And when I went to get my test results, he's like, you are clearly type 1. There's no questions. And I can't believe first of all, they didn't tell me I was type 1. They only told me LADA, which LADA is, even for the American healthcare system, it's 1.5, people. It's 1.5. Has nothing to do with weight. Has nothing to do with anything. You have not done anything to deserve this. I'm going to read you guys a little explanation on LADA. It's called latent autoimmune diabetes in adults. It's a slow progressing form of autoimmune diabetes. Like the autoimmune disease diabetes 1, LADA, occurs when your pancreas stops producing adequate insulin, most likely from some insult that slowly damages the insulin producing cells in the pancreas. So basically, it's like your body is attacking that organ. And I have alopecia. I've talked about it in another video. I very strongly believe that autoimmune disease, alopecia, which attacks, basically attacks my body to make it lose hair, also attacked my pancreas. So from that moment on, when my German doctor said, "Hey, you're type 1," um, my treatment became different. I was not treated as just the chubby girl that, oh, you eat so many bad things, that's why this happened to you. I know that's a lot of times that's the stigma with diabetes. That's why I add this I talk to people, and I'm just like, I'm type 1. I didn't cause this. My weight didn't cause this. It's to no fault of my own. And obviously, when you have type 2, it's not like you purposely thought this would happen to you, obviously. So, you know, give diabetics a break. This, even though I'm 1.5 American healthcare system, 1 in the German healthcare system, even if you're two, give yourself a break. Um, like I always tell my kids, health. If your health is damaged, you can dig your way out of it. It is not something that has to stay with you forever, especially type 2 is reversible. It's like you basically can have it. I believe you have it for the rest of your life, but the symptoms can significantly get lower, which I can't. I am stuck with this horrible disease for the rest of my life, and I'm always going to have to be careful and watch out what I do. But I figured I'll show you guys my equipment for World National Diabetes Day. This is a pencil pouch, a little dragon on it, isn't it cute? And I used to have little bags. I carry with me like little zip bags. I purchase in stores, and I have all kinds of different ones. I've one with Outlander on it, one with cats. I have one with Fuerteventura. It's an island in Spain, near Spain. I went to visit there, and I purchased one of the little baggies to carry my things with me. I try to cutify this disease because it's not a pleasant, nice disease, and you have to cutify it. So this is my Libre 3. I started out with a Libre 2, and now they switched me to Libre 3. I know there's a lot of diabetics stateside that still measure blood, but where you have a blood glucose meter, where you have to stab yourself, and then you have to take the blood drop onto I don't even know what it's called, like a measuring stick, and then the machine reads it for you, which is very accurate as well. This sensor, I do not ever have to scan it. It gives me up to date, it shows my sugar numbers up to date routinely. I don't have to do anything. The only thing what I have to pay attention to when an alarm sounds when I'm too high, and an alarm sounds when I'm low. The Freestyle Libre 3 is significantly smaller than the 2. My husband buys me little stickers, like they're little clear stickers I put on my sensor. It looks like maybe a 25-cent coin, and it basically gets inserted in the skin, but you don't really feel it. at all. You don't feel it. Maybe if you have when you insert it, sometimes very rarely you have something called a bleeder, and then you bleed a little bit and it goes away, and then I can do whatever I want. I can go swimming, take a shower, go take a bath. I do not feel my sensor, but I wanted to show you guys what it looks like. It comes in these little tiny boxes. My health insurance pays for this. The only copay I have to pay about $40 a month as copay. Maybe not even that. Is it maybe $40 or $40 every 3 months? Anyway, I think actually every 3 months, because I get the delivery of my Libra 3 style sensor. I get a delivery like every 3 months. Look how tiny this is. This is very, 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 very tiny. Here's a fork if you want to compare it to. It's literally, and this whole thing is just the packaging. It's not what is inserted into your arm. Usually inserted into your arm. Technically, you're not supposed to insert it anywhere else, but I know some diabetics, they insert it into their legs as well, and their hips, and their stomach. But when something goes wrong with my sensor and I insert it in a different part than their suggestion, they don't replace it. So I'm really careful about only inserting it into my arm area, because this is what the company suggests. And when I have a problem with my sensor, I usually call them, say, hey, sensor number so and so malfunctioned, and then I get a free replacement. What else do I have to do? Let's continue this now. But it's literally a godsend for me. I used to check bloody all the time, and I hated it. It's painful. You start developing calluses on your fingers. It's an utter nightmare. I no longer have to do this. I carry my sensor with me. It's this little tiny thing. It's very small. It shows me my history, my glucose level. I have to charge it. Here's my little charging cable. Might as well plug it in now, so I'm good for the night. Yes, anyway, this is my other medicine, other tool I use. This is it's called Toujours. Toujours is my 24-hour insulin. It's Glargine. I use 2 different types of insulin. Most diabetics use 2 different types. I've heard certain diabetics, they have to have a mixture of insulins. So far, this has worked pretty decently. If I stick to my diet, I take my medicine regular, I can keep my numbers under control. And I also use Novo Rapid. This is my flex pen. It's I think it's called a Humalog. Is that correct? How am I saying it? I guess so. I don't know. It's my food. It's my food insulin. When I eat, I have to shoot, not all the time, but I have to measure my carb intake, and I have to measure if I'm too high at that point to you kind of have to add things. You're too high, you have to add a certain number of units, and for your food you have to add a certain number of units. But of course, if you eat carb free, you don't have to add any units unless you are high. Not high in drugs, I'm talking high in your glucose numbers. So that is always my best friend. Always carry it with me. I also carry a lipstick in my thing, because even though I'm a diabetic and I don't really do makeup all that much, I love this lipstick here. It's 585 Rouge Indian Red. I love it. And of course, these are also my wonderful good friends. These are little sugar things. when I have a low episode when I'm out and about, I have to eat these. And I forgot my most important thing. I have an emergency pin in the kitchen in the refrigerator. This is an absolute like I'm passed out on the ground. I am no longer able to speak or eat or anything to bring my sugar up, and I'm basically in like diabetic coma, kind of like on the verge of an diabetic coma, I guess. I have to have one of these shots. I believe it's just basically sugar, and then you have to add water, and then somebody, whoever is around you, has to give you a shot of that, and that is pretty important for me, because if I pass out, things are not looking very good. Then that is not very nice. That's why I like my sensor, because my sensor lets me know nap time. My sensor lets me know if I'm um, dipping below 75. My sensor lets me know. Well, World Diabetes Day. It's a disease that has lots of interesting sides to it. And for some reason, it's one of those diseases not that many people know anything about. It's a stigma attached to it, especially if you're a bigger sized person. People say things like, well, she did it to herself or he did it to himself. Yeah, be as it may, yes, but maybe the person has an eating disorder, and that's why the person ate that much and got this disease. And what if there's some traumatic event that happened to that person? I mean, nobody wants to die. Nobody wants to be sick. So I try not to be judgmental and try to have a little bit of an understanding. As much as alcohol and drugs can be addicting, food can be addicting too, and it can also be a kind of like a security blanket. So I understand why some people have weight issues. I have weight issues myself, and I'm pretty sure it's because I like to eat. I'm a foodie, and I know I stress eat sometimes. So I try very hard not to do this anymore. And I work very hard on myself and what I eat and what I put inside my body, what I put inside my mind. And I try to make it positive and happy and like, yay! But it doesn't always work. Sometimes you're sad. Diabetes is one of those diseases that causes depression in a lot of people. Why, you ask? Because you feel alienated. There's so many things you want to do, but you can't. Like when I'm going to like a nice party and stuff, and everybody's drinking and having a good old time and eating cake and cookies, I have to really, really limit myself. If I'm having a bad day, I may not be able to eat anything. If I'm having a bad day, I may not be able to drink a glass of wine. And I'm not really a huge drinker, but every once in a while, a glass of champagne, a glass of wine, yes, why not? But in my, disease kind of keeps me in a prison. I have to follow a lot of rules. I have to check my sugar all the time. I can't leave the house with at least this. At least I have to have this. And then, of course, I have to have my insurance cards just in case something happens to me. Because, if I need to get picked up, I need my insurance card, and I need my ID because I want to be identified. And then I need my diabetes pass. I have a little pass with my information on it. So it's like I never can just leave the house and just be like, oh, I'm just going to leave the house and walk around my neighborhood and have a good old time. It doesn't happen like this. And it sucks. It sucks. Also, I always feel like I'm a little bit of a burden to my husband, because there's plenty of times when I wake up in the middle of the night and I'm like, oh, honey, my sugar's low. Please, can you give me something sweet to drink? And I start shaking and feeling very ill. And my husband, gets up and helps me, and I'm always just kind of like, man, I'm the young one in the relationship. But I'm the one with the problems. So anyway, happy National Diabetes Day. Even though it's already passed, be kind to those with diabetes. We never know why a type 2 person became a type 2 person, why they gained weight.